A very good evening. You're with iMed on Channel I, and on iMed we usually talk about different kinds of diseases when it comes to the human body and also the complications that comes along with it. Now usually we do invite an expert of a said subject, well, in the discipline of medicine, of course, a different disease on a different day. So today we have, well, a different topic indeed. We have the topic of asthma and its related aspects. We're going to talk about asthma. Now, to talk about this, we do have with us the consultant pulmonologist at the Teaching Hospital and District Chest Clinic in Ratnapura, Dr. Niranjan Disanaika with us. A very good evening to you and welcome to the show, Doctor.
Thank you very much for inviting me, and it's a pleasure to be here. Thank you.
The pleasure is ours, sir. Now, as our viewers might know, the World Asthma Day was commemorated on the 3rd of 2022, and it's an annual day which is celebrated every year. And this time the theme issued by the WHO is closing gaps in asthma care. Now we're going to talk about all of this, but before that, usually when we get into a topic, we have to define what we are talking about.
Yes.
So, Doctor, my first inquiry to you would be, what is asthma? What are the types of asthma?
Yeah. Asthma is a very common disease, and there are a lot of misconceptions associated with this. And as you correctly said, I think we have to clear the air before we start any discussion about asthma. So when we think about our human body, the lungs, actually the windpipe starts around from the throat, and then it divides into two in the mid-chest area, and it continues dividing until the very small airways are opened into the air sacs. And it is from these air sacs that the atmospheric air is being contacted indirectly with the blood supply. Hence, oxygen can go into the blood, and then the carbon dioxide in the blood can come into the air sac, and then you can take it out. I explained this structure simply because in asthma, the main structure that is involved is the small airways. Now we have a large windpipe going down here, and it divides and divides and divides, and at around 1 to 2 millimeters we call it the small airways, which take from the large airways to the peripheral airways, and this airway is narrowed in asthma. So that is basically the pathology in asthma that we see. And if we can have the first slide, we can see that the airway, this is actually a cross-section of the airway that we can see. And in the airway, we can see that the blue one is a normal airway, and the red one is an asthmatic airway. And the blue one, we can see that there's a nice diameter. The diameter is normal, and there is smooth muscles surrounding the airway which are relaxed, and it keeps it open, and there are no significant amount of mucus or secretions in these airways, and hence you can breathe freely. But in the one in the left, you can see the reddened airway, the red airway.
One in the right.
Sorry, one in the right, and there is a significant narrowing of the lumen of the airway. And when you know that, when there is significant narrowing of the lumen of an airway, the resistance to flow increases.
If I ask you, Doctor, what is a lumen? What is the lumen?
Lumen means the opening of the airway, right? The cross section of the airway. So, for example, in a pipe, when the pipe gets narrower, the pressure that we need to push out water from that pipe increases. So, hence, when the lumen or the inside of the diameter of the airway is narrowed, you need to get more power to get a simple breath, and that is what actually happens in asthma. So it is basically, to answer your question, it's basically a problem with the airways, out of which the small airways are involved than other parts of the airways, and the airways are narrowed, and this narrowing is reversible. That means it can come back completely back to the normal state, unlike in certain diseases that we can discuss later. So that is basically the hallmark of asthma. So simply it's a disease of the airways which makes you breathe harder whenever that happens.
Now, I think that was an all-round answer for my question, what is asthma? So there are types of asthma when it comes to defining the disease as well.
Yep.
Different kinds of disease types.
Yes.
So now moving on with the next question, What are the symptoms? Now, the WHO has named asthma as the most common chronic disease among children.
Yes.
So that's not a joke.
Yes.
That is not a joke. This matter should be taken seriously. So if a child, say anyone, adult, say anyone, wants to identify the disease, what are the symptoms?
I think we have to understand the symptoms depending on the facts that we brought out earlier. So asthma basically is a narrowing of the airway. So as I told you previously, when the narrowing is there, the resistance to the airflow increases. Hence, to take a simple breath inside, you need more power, right? So for example, if the diameter is halved, the resistance increase 8 times. So that when the diameter is halved, you need about 8 times more power to generate from the thoracic wall to take a single breath. And that is, so the most important complaint in asthma is basically shortness of breath. They feel breathless. They feel that they are not taking enough amount of air inside to their lungs. That is one of the hallmark features of asthma. And when this airway is narrowed, you can imagine that when certain amount of air is passing through a narrowed airway, there are some sounds emanating from that, right? So these sounds can be heard from outside even when the asthma attack is severe, right? So that is what we call wheezing. So basically, when the airways are narrowed, when the air is traveling through that, there will be a certain vibration, and we can hear it as wheezing. So that is the second hallmark of asthma. The third hallmark of asthma is that, why this narrowing occurs is because there is an inflammation. There is damage inside the lumen of the airway. There can be various causes. As you said, there are various types. But finally, there will be a damage of the airway inside. And when you have a damaged airway, it becomes what we call hyperresponsive. For example, if I touch your hand, you will not feel anything abnormal other than the touch. But if your hand has a wound, like a burn, and if I touch it, you will definitely take your arm away from me. So that's a reflex. So when these airways are damaged, there will be a reflex narrowing of the airway, whereas the mechanical stimulation and the chemical stimulation will cause cough actually, right? So the cough will be another symptom. And the same time, as I told you, because the thoracic wall of a person tries to breathe in with this huge amount of resistance, and they will feel chest tightness. And sometimes they can go to a cardiologist thinking that it's coming from the heart, but actually it's coming from the chest. So chest tightness is another important symptom that is there in asthma. And if we can look at the second slide, please, I think we can understand the basic symptoms of asthma in a beautiful way. So main 4 symptoms of asthma, the hallmarks of asthma is, one is difficulty in breathing.
I think we can see that.
See the slide. Yeah, see the slide. One is the difficulty in breathing. The second is cough. The third basically is the wheezing sound, and the fourth is chest tightness. Those are the 4 main causes, 4 main symptoms that you can see. But some other features can be there, especially if you can imagine that if the patient is having to breathe under tremendous stress, at the end of the day he will be tired. And tiredness is another feature that is asthma. But the 4 defining features are the 4 that I described earlier.
So now, doctor, I just wanted to ask, can emotional activity, can that affect asthma?
Actually, yes. Now, those are what we call the triggers of asthma. So, if you have the next slide showing the triggers of asthma, I think I can explain to you it further. So, as I told you, asthma is a reversible disease. For some time, for about 3 or 4 years, you can have symptoms, one or more of the symptoms that we described earlier, coming in and being there for about few days, few months sometimes, and then completely goes off. That is a hallmark of asthma. So in between, you might be feeling completely normal actually. You can climb stairs, you can even eat ice cream, but during attacks you are symptomatic. So that is a hallmark of asthma. It's a reversible one. So if you look at the triggers again, so when the airways is damaged, as I previously suggested, because of the asthma, the inflammation that is there, then there are some factors which doesn't cause asthma but triggers the airway that is already damaged. So these are different things. The causative factors are different, the triggering factors are different. The causative factors of asthma is basically genetical, right, most likely, and there are some environmental factors that might predispose one to asthma. But here are what we call the triggers of asthma. One important trigger, as you said, was anger, frustration and anxiety. Now I see some children who are nearing the exams coming to me with increasing amount of symptoms. And the other one important triggering factor that we have to identify is the indoor air pollution. That means I think in most of our bedrooms, unfortunately, we keep a lot of things. So for example, if I remove this shirt and hang it, there will be some amount of my cells attached to this, by dead cells, and on those there are certain organisms or certain mites that can grow, and their excreta is a triggering factor, a severe triggering factor for asthma. Hence what we advise is to remove all these from the at least from the rooms. Cockroaches, mold, dust, smoking, indoor air pollution, smoking of the father or mother, all affects and all triggers asthma attack.
Now, doctor, as you explained the trigger factors, I think I've heard about this as well. If you find the specific trigger factor of the specific patient, because patient to patient it differs, the trigger factor differs. So if you can find the trigger factor of that specific patient, I think asthma is controllable, right?
Yeah, in a way, I think your hypothesis is correct. If we find a specific trigger factor to a certain person, so there are some people who can be allergic or who have a reaction to only a specific protein or substance or allergen, what we call. For example, he might be allergic for the pollen of the coconut tree, right? So if that is the case, if he is removed from that environment and if he can control the exposure, yes, he might not get asthma attacks at all. But unfortunately, when living in the true world, most of us and most of the asthmatic people are having triggers or allergic to various substances. Hence, it's not a single disease, it's not a simple disease, and you have the potential to develop allergic reactions to many substances. Hence, what we have to try to do is we have to reduce the amount of allergens in your environment as much as possible. And we have to reduce the amount of trigger factors in the environment as much as possible. So if we can achieve that, I think that will be the answer to reduce the asthma attacks as much as possible. So as I told you previously, having a clean environment at home, removing unnecessary things like clothes, books, old papers inside from the room and taking it out, because that has a potential to have multiple organisms that are growing, like fungi, various insects which might be allergic to, like cockroaches. And the other thing is removing your bed linen regularly and putting into dry sun, and having the pillow and the pillowcase out in the sun, so that whatever the small organisms that are there can be killed. Sometimes these organisms might not be killed by water, so we have to boil them, but it is not practical. So one way of doing it is putting these clothes into the dry air, to the sun. So there are various ways that we can do or prevent or reduce the amount of triggers. But it's very important to understand the triggers, because sometimes pets can be a trigger. Their dander and their proteins can be a trigger. But if actually this child is not allergic to that pet dander, removing that pet can be harmful to that child's psychology. For example, if he has a nice cat or a dog as a pet, and simply because he is having asthma, we don't suggest that it should be removed from him. If we think that if there's a possibility, and by investigations if we find that this patient is specifically allergic to that, yes, we can talk it out and we can give another pet to her and remove that. But so that is why. So sometimes, as I said, it's very important to understand the specific trigger rather than just going around. But unfortunately, most of the time we have to maintain the other cleanliness and other factors, remove the irritants to control the asthma.
I think that's really important, and it's not just about one thing, is it?
No.
It's a collection of matters and a collection of things which can affect an asthma patient. So now let's move on to the history of the asthma disease and how this disease have evolved throughout the 21st century, you know, because the world has globalized and the world has been industrialized.
So the history of asthma, I think, is probably goes back to the evolution of the mankind, and various transcripts, medicine transcripts in Egypt, in Greece, and even in India, Shushruta and Samhita, mentioned symptoms that are similar to asthma. Actually, the word asthma comes from the word azine, that is panting, that is breathing rapidly. So that basically is the symptom that they have seen previously. So that is how we describe it. And even the singular word aduma means adinama. That means he's trying, as I told you, he's trying markedly very hard to breathe in. So that is what they have found, actually. So this has been going on for some time, and there have been descriptions in the ancient literature about asthma as well as the treatment. Actually, the first possible inhaler for asthma, what they have done is they have kept some leaves and put some heat under that, and then they have inhaled that. And in Chinese, they have used herbs that can dilate the airways, certain herbs that can dilate the airways. So it has been there for some time. But in the 1960s, you know, the early 1800s and the 1900s, I think the golden era. So there we understood that the most problem lies in the airways of the lung. The problem lies in the airways of the lung. So what that problem is, there were a lot of debates. So in the 1940s, 1960s, they thought that it is mainly the narrowing of the airway, and then later they identified that this problem of the narrowing of the airway is because of the inflammation, that is a damage, chronic damage to the airway that happens. So then they were focusing on the inflammation. Then they found that again there is a combination of the inflammation and the airway dysfunction. So now actually we try to treat asthma as a combination of inflammation as well as airway narrowing, unnecessary airway narrowing, because as you correctly said, there are types of asthma where sometimes inflammation cannot be found. That means damage cannot be found. That is basically because of a neural dysfunction, and it has to do with some neural mechanisms where you can have a airway dysfunction. So there are various ways that we can go through this. So
I think, yeah, we keep coming back to the same point.
Yes.
This is not just a simple matter. This is a very, very complex.
Yes.
And that's why we started the program saying the complications that comes along with these diseases. Now, today it's about asthma. So now I want to ask you, why are we still worried? Now, you did mention this disease is not actually curable, but it is 100% controllable.
yes.
Now, why are we still researching, why are we still talking about this disease, if I ask you that question?
Now, I think that's a very good question. One thing is that asthma affects about 250 to 300 million people in the world. So it's almost about 15 times the population of Sri Lanka, I think. So it's a very prevalent disease in the world. And unfortunately, about 450,000 people die yearly. Now the importance of asthma is that asthma is not a disease that a person should die, to tell you the truth. In dengue, yes, we expect a certain degree of mortality. In even tuberculosis, which is an infectious disease, we expect a certain degree of mortality. But in cancer, certainly yes. But in asthma, if we manage these patients properly, I think most of these people can be managed without dying, without causing a significant problem. So that is the most important part. There's a huge amount of people that are affected, and unfortunately, some degree of people, a certain percentage of them, are still dying of this disease. And you highlighted a very important point, saying that asthma is not curable and it is controllable. I think we have to get it into our mind very correctly. So if you take diseases like hypertension, diabetes, now even there, if we control the diabetes properly, you will almost have a normal life without any problem. So asthma is a disease similar to that. Right? So some people say that, okay, when you take the drugs, you don't have any symptoms, and then you are cured of the disease. Right? And after some time, you get another attack. But during this time that you have been asymptomatic, that means you didn't have symptoms, this process, the disease process, goes on without knowing. and then at a certain point of time it reaches a critical point, and then you get the attacks. So sometimes you might need hospitalization, sometimes you might even die of this disease. That is the important things of asthma. It might be silent while you have the disease.
Basically a silent killer.
Sometimes, yeah. You can describe it as that, yeah.
Yeah, and Doctor, we have come towards the latter part of the program as well. Now, the final question from me to you would be in this program. I mentioned earlier in the program that we did commemorate the World Asthma Day on the 3rd of May. So, what is your message to the general public out there watching today's show? What is your message?
I think the main message would be that as you said, we commemorate the Asthma Day on the first Tuesday of each month of May every year, and the main reason is to make aware about this dreaded disease, which can be controlled if we take the proper measures. So my message to the general public is that asthma is not a disease that you should hide off. It is not a stigma. It is not a disease associated with stigma. Now, if we have the correct means of managing asthma properly, and we in Sri Lanka, we have all the facilities to manage asthmatic patients without having any effect in their lives. The important thing is that for the population to identify people who are having asthma and to seek correct medical treatment from a professional who is experienced from that, because asthma is a very common disease in Sri Lanka. And if we don't correctly treat it, there can be consequences to your life as well as to your personality, your economy, and the social structure as well. So identifying asthma, treating asthma properly will, I think, help mitigate most of these abnormal or these dysfunctions that you will have due to asthma.
I think that was an all-round answer as well. Thank you so much, Doctor, for joining with us in an insightful conversation about asthma, which should be given priority in these times. So we did have with us the consultant pulmonologist at the teaching hospital and district chest clinic in Ratnapura, Dr. Niranjan Disanayaka, with us. So thank you so much, Doctor, amid your busy schedule, for joining with us. So next week we will be talking about the same topic, a continuation into a much deeper conversation. So thank you so much for joining in, and thank you so much for joining, Doctor.
Thank you very much. It was a pleasure.
And with that, we wind up today's segment of iMed on ChannelEye. Thank you so much for joining in. Tune in next week. Have a pleasant day.
And this reflex narrowing